I would like to provide an overview of weight loss surgery procedures, the gastric bypass and the sleeve gastrectomy. We'll talk a little bit about the two operations and how they compare. We'll go over some of the techniques that we use. We'll even show you the stapler that we're going to use when we do these operations. We'll talk a little bit about the risks and the benefits and maybe help you make a decision about which operation might be right for you. Whether we're doing gastric bypass surgery or sleeve gastrectomy, we use a laparoscopic approach. This means we put a camera near the belly button so we can see inside, and we use other small incisions to place the instruments that we need to do the work on the inside. When we perform gastric bypass surgery, we use a surgical stapling device to cut across the upper part of the stomach to create a small stomach pouch that's totally separated from the rest of the stomach. In order to get food from this pouch into the intestines where it can be absorbed, we have to create a connection directly to the intestines. We take a part of the upper intestines and connect it with the stomach pouch, and then we create a second connection in the intestines so the digestive enzymes can mix with the food. This creates a Y-shaped connection in the intestine, which is where the Roux-en-Y gastric bypass gets its name. The end result is that a small amount of food fills this golf ball-sized pouch, and it bypasses the rest of the stomach, entering directly into the intestines. The food then mixes with the digestive enzymes at the Y-shaped connection and gets absorbed normally in the rest of the intestines. The intestinal bypass does create a malabsorptive mechanism, so things like vitamin B12, calcium, and iron can be affected. That's why we prescribe supplements for these. But the primary effect of the procedure is the restrictive effect, the creation of the small stomach pouch. When we perform sleeve gastrectomy, we use a similar laparoscopic approach, although sometimes we're able to use fewer incisions than we do with the gastric bypass. Remember that with the gastric bypass, we create the small stomach pouch by cutting across the upper part of the stomach. The food that's in the stomach pouch needs some way to empty into the intestines, and that's why we have to create additional steps of rerouting a part of the intestines. With the sleeve gastrectomy, we use a different approach to reducing the size of the stomach. We actually divide the stomach along its length instead of across. This creates a sleeve or banana-shaped tract leading down to the pouch. It's about the same capacity as a gastric bypass. With a sleeve gastrectomy, a small meal can fill the pouch, and the food empties into the intestines in the usual anatomic way. There are fewer steps involved when performing the sleeve gastrectomy since we don't have to create intestinal connections like we do with the gastric bypass. Using laparoscopic approach definitely has some advantages compared to traditional open surgery. The smaller incisions definitely have less scarring, less visible scarring, but that's not the only benefit. The smaller incisions, I'm sure you can imagine, they're not pain-free, but it's a lot less incisional pain than you have with a big open incision. And because of the smaller scarring and the smaller incisions, usually people are able to bounce back from surgery a bit quicker. They're able to get out of the hospital a little quicker, back to work a little quicker. And so there's definitely some advantages there. The smaller incisions also have less risk of wound healing complications like drainage and infection and problems like that. Even hernias have a much less risk with laparoscopic surgery. When we do laparoscopic surgery for either a gastric bypass or a sleeve gastrectomy, we use staplers just like this when we're doing the operation. And part of the reason why we show you the stapler is because I think a lot of people, when they hear the word stapler, they get a little squeamish. Or maybe they think about their swing line on their desk at work. But a surgical stapler is actually a very precise machine. It's may not be very obvious to people why we use instruments like this when we're doing an operation. One of the reasons why we use surgical staplers like this is because it doesn't take a very big incision at all to get this to go inside so that we can do the work on the inside. Our hands can be out here on the outside manipulating the instrument, but the connections and the seal that's created on the inside between the stomach and the intestines, for example, is created without us having to make a big incision. Another reason why we use staplers like this is because the connections and the seal that we can create is actually a lot more secure and a lot more reliable, reproducible, than if we were sewing it up with a needle and a stitch by hand. So this is why surgical staplers like this are used. It's the fact that instruments like this exist. This is why we're able to accomplish more complex procedures laparoscopically. And I can show you how it works. Basically, it's more easy to show you how it works than it is to try to explain it. But basically, if you consider a model of the stomach, and if we're doing a gastric bypass, remember what we want to do is create a small pouch out of the top of the stomach. If we're doing a sleeve gastrectomy, of course, we're going to make the pouch on here with a little sleeve leading down to it. But say, for example, if we're doing a gastric bypass operation, we can use the stapler to cut across the upper part of the stomach, and the stapling device itself actually produces a cut across the tissue, and at the same time it seals that cut edge to prevent fluids from escaping from the stomach or from the intestines. And you can see that if I use the stapler and I kept proceeding up this way, like this, I would totally separate this part of the stomach from the rest of the stomach, and that's how we produce the gastric pouch. Same thing applies with the sleeve gastrectomy, right? If I start down here, we can create a pouch and cut across the stomach this way. So whether we're doing an operation laparoscopically or open, there's still the same operation steps done on the inside. We're still doing the same procedure. And there still are risks incurred by surgery. And anytime you have an operation, no matter what it is, if we're having to use anesthesia and make incisions, there's risks of problems like infection or bleeding or blood clots or heart problems or pneumonia. You can even have a reaction to the anesthesia or the antibiotics that we use. So any operation, whether it's a gastric bypass or a sleeve or whether you're having your gallbladder moved, any operation is going to have some baseline level of risk. And so in that sense, these operations really aren't any different than most other common abdominal operations. There are risks associated with an operation like this, but if a person is morbidly obese, there are also risks associated with not having surgery. And when you look at it from that perspective, you come to realize what we mean when we say that the benefits of surgery far outweigh the risks when a person is morbidly obese.